Things I wish I knew before starting my urgent care rotation as a nurse practitioner student, okay? Part one. This is gonna be part one because I have a lot to say and it might not like fit in this video, so I'm just gonna make part two. So if I could go back before my urgent care rotation, these are my like top two diagnoses I would like study first because you'll see them like every day, every shift. And our number one is ear infection. Please, please, please learn ears. Urgent care is like full of ear pain visit. Get yourself an otoscope, start practicing on your family, friends, anyone, okay? And the things you need to know are like what our normal tympanic membrane looks like pearly white gray, right? What abnormal looks like, bulging tympanic membrane, redness, fluid behind the ear, like loss of landmarks and all that, right? And also, please learn difference between otitis media, otitis externa, and eustachian tube dysfunction, because not every pain is ear infection, right? So, know your common antibiotics too. What are the first line antibiotics for ear infection? Amoxicillin. What's the alternative? Cefdinir. And like if the patient is already on antibiotics or symptoms are getting worse, what is it? Augmentin. Yep. Also, documentation matters a lot in urgent care. Learn how to properly like describe your examination finding. And my number two is UTI. I did make a video about like UTI, so if you want you can go and like check that video out. But yeah, know your sign and symptoms, like UTI sign and symptoms. Look like what you were looking on UA, like complicated versus uncomplicated UTI, what when it becomes pyelonephritis, what are the common antibiotics that you would use for UTI, like nidofurantoin, Keflex, Bactrim. Know about like antibiotic resistance and big red flags like fever, flank pain, severe tenderness, vomiting, sepsis symptoms. This patient may needs to go to ED, right, for evaluation. And don't forget, like important one, like kid can get, like little kids can get UTI too. If the child has like unexplained fever, accident, abdominal pain, or urinary symptoms, think of UTI. One more thing that no one talks enough: always stay aware of like possible abuse if something feels off during the visit. Yeah, and honestly, urgent care teaches you like very fast. So, yeah, I did learn a lot in urgent care. And I'll see you guys in part two. Thanks.